Good afternoon, ladies and gentlemen, and welcome to another live broadcast of State of Our Nation. Now, today is World Health Day, and aptly, we are focusing our discussion on just some of the key topical issues dominating the national discourse. In the last 2 years, especially, we have witnessed health matters coming down to a dichotomy between wellness and economics. This is certainly the case during the COVID 19 pandemic, and it has again manifested in the just implemented 20% tax on sugar sweetened beverages. We have also have the issue of rising cost of living and how this is going to impact the affordability of healthy food choices. Now, here with me to unpack as much as we can this afternoon in the time allotted to us is healthy lifestyle advocate and a member of the Barbados Childhood Obesity Prevention Coalition, Dr. Kia Lewis. Dr. Lewis, welcome to State of Our Nation.
Thank you so much for having me.
Okay. Now, Dr. Lewis, we are getting the sense that this issue of NCDs and childhood obesity, which obviously can develop into those non-communicable diseases, is a matter that has to be dealt with urgency. Hence, the decision to implement the tax, and we are also seeing plans in place to or hearing of plans in place to curtail these drinks in schools as well. Paint me a picture of what the landscape is like as it relates to childhood obesity at this point, and why the need, and why the urgency at this point.
Right. So, childhood obesity has been a problem in Barbados for a number of years, and there have been a number of persons within the healthcare sector, as well as coalitions like the Childhood Obesity Prevention Coalition, who have been speaking to the statistics and how alarming they are. As it stands, we know currently 1 in 3 children in Barbados is either overweight or obese. And I think the major concern for us, these statistics existed before the pandemic. And we're pretty confident that having gone through the pandemic, children became less active and they were exposed to more unhealthy food choices. And therefore, we think that the obesity rate might be even higher. We will need statistics to show that. But the concern really is that we know that obesity in childhood predisposes these young children to developing things like hypertension and diabetes, the NCDs are non communicable diseases that we always talk about. It predisposes them to developing these conditions from a very young age. And that means that they can have a very aggressive course, they can develop the complications a lot younger. That's a major problem that we have to look at.
Okay. Now, as I mentioned earlier, and that was my segue into the whole notion of the sweet drink tax as well. The argument has been reduced to a wellness versus the economy. And much of that determination as to which argument is going to prevail will come down to the effectiveness of the measure. I mean, what evidence do you have at this point that would suggest and give Barbadians a sense that this would serve as an accurate, as an adequate, deterrent, especially for children, um, in terms of that tax? Do you think it's going to be an adequate deterrent? Is it going to be effective?
So the first thing I will say is that while we talk a lot about childhood obesity, the tax is not just targeted towards children and reducing the burden of obesity among children, but it's targeted towards increasing the health of our nation. When we look at the nation, we know that chronic diseases account for 8 out of every 10 deaths that we experience in Barbados, which is staggering. 80% of our deaths are as a result of non communicable diseases. So we're looking at a much bigger picture. When we talk about economics, we spend millions upon millions of dollars yearly in expenses as it relates to the care of persons with NCDs. We spend over 100 million as it relates in expenses due to loss of productivity in the workforce because of persons who are ill as a result of their NCDs. And so we see that we have a major picture where we are losing lots of money, but more importantly, we are losing lots of lives. So when we talk about the sugar sweetened beverage tax, we are tackling a much bigger issue. Now, I've heard many people say, well, it's not going to work. It doesn't make any sense. People will buy what they want. And we heard these kind of arguments when similar taxes were implemented, for example, with cigarette use. What has the evidence shown when it comes to sugar sweetened beverages? The first thing I will say is that this measure is not something that the government just woke up overnight and did. This is something that World Health Organization has recommended as a part of a suite of policies aimed at reducing NCDs among nations like our own. So it's a part of a bigger picture, number of policies. That's the first thing. The second thing is that we were at the 10% some years ago, and organizations like Heart and Stroke Foundation Barbados, for example, we were lobbying Healthy Caribbean Coalition. We're saying that we know that the research shows that the 10% is not adequate to get the effect that we want, but we really need at least 20% to begin to see the kind of effect that we would want, right?
Right.
And at that time, I think there was a lot of the issues with the industry and so forth that kept the tax at 10%. But this is not a recommendation by government. This is a recommendation that is coming straight from World Health Organization. And what we have seen around the world, there are at least 46 countries and more who have implemented this tax, and many of them successfully so. So, for example, in the United Kingdom, we have seen a significant reduction in the consumption and purchase of sugar sweetened beverages as a result of their tax. Mexico, we've seen the same thing. And I could name a number of countries. So to say that the tax is not effective, that's not what the research shows at all. As it relates to the income affecting the economy, what the research has shown is that the tax actually does not lead to any net job losses in the industry. The research is clear on that. The well-balanced research is clear on that. And that what it instead does is it pushes the industry to reformulate. That's a big word that simply means it pushes the industry to reduce the amount of sugar in their beverages so that they can continue to make good sales. And it also pushes them to market their healthier products instead of the unhealthy ones. So the research is clear that it has worked other places, and therefore we really do not have a solid basis to say that it will not work here.
And it's also important to note, based on what I have research I have done as well, that the drinks that are the healthier alternatives, those actually go up in terms of consumption. And also in the
They
case of
do.
Barbados, the drinks are manufactured pretty much by the same persons, the same persons that manufacture the higher sugar content drinks also manufacture the healthier alternatives as well. So there is the case to be made that jobs may not necessarily be lost. But then there's also the argument, and I'm being devil's advocate here. There's also the argument that they are not, or at least drinks alone, are not the only things responsible for the situation of NCDs in Barbados, and therefore they might think that they are being unfairly targeted to some extent. I mean, I can assure you that the pounds that you see on me right now, not all of it goes towards sweet drinks. The fast food industry has to take some of the blame for that. What are your thoughts on that?
So first, let me say, because you mentioned Barbados, and in the local context, what we have found as it speaks to the evidence, even with the 10%, we had a reduction in the purchase of sugar sweetened beverages by at least 4%, and we had an increase in the purchase of water by almost 7%. So you are right in saying that yes, the it is effective in Barbados, and the same companies that produce the sugar sweetened beverages produce the healthier alternatives. So your question as to why we targeted sugar sweetened beverages, I say to people, this is due to research. Research, research, research. The studies have shown that our consumption patterns in Barbados, the majority of our sugars come from sugar sweetened beverages. So I know there are persons in the industry who have said, we need more studies, we need to know where the sugar is coming from, where the intake of sugar is coming from. And I say to Barbadians, the studies have already been done, and they have shown that the majority of our consumption of sugars does indeed come from sugar sweetened beverages. Now, your pastries and your cakes and bread and those kind of things are close behind. Sweetened beverages contribute towards the majority of the sugars that we are taking in. And that's because it's so easy to take in large amounts of sugar quickly in a drink.
Okay. What are some of the other alternatives that we can address? I mean, obviously, the sugar tax is not going to be the answer for the entire problem. In from your professional perspective, what other alternatives, what other measures, not alternatives necessarily, but what other measures um, we can implement at this stage that would also put a dent in our NCD situation at this point?
There are a couple of things that are on the table right now and that we are actually pushing for. So I'm glad that we're going to have a holistic discussion because people keep saying, well, taxation alone is not sufficient. And I want to say I wholeheartedly agree. Taxation alone is not sufficient. It is a good start, but it's not sufficient. So one of the things that we are looking at is the school nutrition policy, which is heading to cabinet shortly, which looks at providing a healthy environment for our school children. And one of the first things that we're looking at is removing sugar sweetened beverages from the schools. We're also working with the canteen owners as well as the vendors. We're doing training. Heart and Stroke Foundation Barbados is going to be doing training with them at the beginning of April. So people can look out on their pages to see the information there to help them to adjust their menus so that we have something that is healthier. Of course, this would also incorporate like the school news service so that we know that we are serving our children things that are healthier, and we would incorporate education as well, because that's a big, big component of it, so that the children understand why they're eating what they are eating. They're encouraged to bring fruits. So it's a very holistic plan as we look at the food nutrition policy. And we can see the importance of that when we talked about the rate of obesity and overweight within our community, within the children in our community. The other thing that we are eagerly looking forward to is front of package labeling. Front of package labeling allows consumers to very easily spot when something is high in fat, high in salt, and high in sugar. I don't know if you have noticed, but the food labels that are at the back that will tell you about the amount of sugar and the amount of salt, they're very small and very difficult to read. This presents a problem to the average person who's in the supermarket and just wants to get in and out quickly. Not only that, for persons who have things like diabetes and hypertension and are older and might have problems with their eyes, there's this difficulty in reading the labels, and you have to know how to read the labels, how to interpret the serving sizes, etc. So front of package labeling allows regular people to be able to look at a product and say, well, this is high in sugar because it says it on the front, or it's high in salt, and therefore this is something that I might want to reconsider or use less frequently. That is something that we are pushing very, very importantly. And of course, we are always interested in education, 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 education. We want to teach people about how to live a healthier life. We want to do workshops and those kind of things. We want a community approach so that people have support in making the changes, because behavioral change is not easy, but it's possible with the right amount of support.
Okay, I have a comment here from Miss Fidelis Saint Hill, and it plays into a popular view that carbs, the high intake of carbs, is the problem more so. So you're talking, and I've been to many nutritionists and gym instructors, and one of the first things to tell you, cut out bread. Is there credence to that point of view in terms of that is the bigger problem altogether,
We can't say
one of the major problems altogether.
Right. We can't say it's the bigger problem because the research needs to back that, but we
Okay,
can say
yes.
it is a major problem for sure. Because the study that was done did show that consumption of cakes and bread and so forth are contributing to our sugar intake. We know that when we take in starch, that it's broken down into sugar. So your sugars don't only come from things that are obviously sweet, but it comes from your cakes, your pastries, your pastas, etc. The thing with that is that in Barbadian culture, we like our starch heavy. So anytime you go out at night to buy chips and chicken, you're gonna get a huge portion of fries and a little piece of chicken on the side. If you go and you look in the average household on a Sunday, because that's the time that most Barbadians have their vegetables. Everybody doesn't have vegetables every day, but at least on a Sunday we try. You will find a large portion of macaroni pie, a large portion of rice, a large portion of sweet potato pie, potato salad. All of that is starch. That's going to take up about three-quarters of the plate. Then you're going to have your meat, and then you're going to have a sprig of lettuce, to say that you're getting in your greens. Maybe two
Right.
carrots and a little Christophine so that you feel good. So that is a problem. We are taking in too much starch. And ideally, what the plate should look like is that a quarter of it should be a healthy starch, a quarter of it should be a healthy lean meat, and half of it should be your steamed vegetables and your fresh salad. But that's not what we do as Barbadians. And that's something that we have to change culturally. So, yes, I agree that our over intake and our love of consuming carbohydrates is definitely contributing to the problem. And it's something that we need to address through education.
Okay. And then also we have Miss Magella Marksman, and they are making the point about genetics. Obviously, I don't. I am no medical professional by any stretch of the imagination, but I would like to know how much genetics account for uh, childhood obesity, was children being big in Barbados. I
Mhm.
mean, is that a fair assessment point?
Genetics will account for majority of NCDs. In other words, if you had relatives that were obese or had diabetes or had hypertension, there are things within the genes that can affect the way that your body breaks down and uses your food that can predispose you. But genetics is not the major component. And again, research has backed that genetics, while it plays a role, it's not the major component. It is actually our lifestyle. So what we are doing. Many times when you see families where everybody is obese, it's because they have similar eating practices, right? So if persons are struggling with their weight, they might be eating the wrong things or eating too much of even the right things, and they're going to train their children like that from young. And so you see the poor health practices are passed on from generation to generation, and the genetics only compounds the problem. You will always find there be one or two people in the family who do not have that problem. And many times, if you talk to them, their diet is much different. So they don't have the hypertension, the diabetes, they're not obese. I mean, you talk to them, they eat a lot differently or they're more active. There's something that sets them apart from the rest in many, many cases. So I want people to know that more importantly than your genetics that you pass on to your children, the lifestyle habits that you are teaching them from now, that is way more important. You can't control your genetics, but you can control the lifestyle choices that you teach them. You can control teaching them how to eat the appropriate portions. You can control teaching them how to eat their sweets in moderation. In other words, not having sugar sweetened things every day. You can control training them up to be active and involved in sports. Those are the things that are going to make the biggest difference in their lives long term.
Okay. Now, if we may switch gears a bit, I mean, obviously, the talk of the tongue right now is the rising cost of living, and obviously, with that comes uh, the rise in the cost of healthy foods as well. I mean, what is the real fear from the medical fraternity at this point, as it relates to persons, especially given our NCD situation in Barbados? What are the fears of the medical fraternity as it relates to affordability of healthy foods, which obviously could help to lessen or bring some control to our current situation?
Well, I don't want to speak and say I represent the fears of the medical community. That's a weight that's a little too heavy for me. But I can give you my personal
But you
opinion.
are a member
What I
of that.
Yes, I am a member, but I'm sure there are people who might share different views. What I will say is that it's a balancing act. I think on one hand, there's a misconception that healthy eating is so much more expensive than eating unhealthily. What I will say is that we spend a lot of money in fast foods. If you pass any drive-through on the weekend, they are packed. Fast food is extremely expensive. And that is a place where people can save a significant amount of money. And that can go towards the supermarket bill, which allows you to buy healthier things. The other thing is that when people think healthy foods, they think like quinoa, they think strawberries, they think the most expensive things, grapes. But eating healthy does not have to mean that you choose the most expensive things. If you choose local fruits and vegetables as they are in season, you can get pretty reasonable varieties of fruits and vegetables, and you are supporting the local farming community. And that's really important. Heart and Stroke Foundation Barbados in assisting the Ministry of Education in formulating the school nutrition policy. We went into the supermarkets, we compared the prices of sugar sweetened beverages as well as the average unhealthy snacks that are served to children daily, to those of what we would call the healthier alternatives based on nutrition facts. We had a number of people on this panel, including doctors and nutritionists. So these are experts that know what they are doing. And interestingly, what we found is that fruits and vegetables and some of the healthier snacks are actually a lot cheaper to give your children than the more unhealthy versions. And of course, water is always cheaper than your sugar sweetened beverages because, for the most part, it is free. You pay a monthly bill, you can fill up your bottle as much as possible. So I think when we talk about the cost of living, we need to acknowledge that people need to be equipped with strategies on how to save money and how to eat healthy on a budget. But I said that it's a dichotomy. The other half is that during the COVID-19 pandemic, when we did the Healthy Hampers project, this is where Heart and Stroke Foundation would have donated healthy hampers to those with NCDs, those who were the most vulnerable in Barbados. It really opened our eyes to how these vulnerabilities,
Yeah, tongue twisted there. Don't
how the
worry.
difficulties, tongue twister, how the difficulties that persons with NCDs that do not have jobs or have very low paying jobs, those difficulties can affect their ability to make healthier choices. And that is a reality. And so, from a perspective of government and just a corporate responsibility, we want to ensure that we have a healthy basket of goods that is kept relatively free from tax. So, when we look at our locally produced fruits and vegetables, my question would be, is there anything that we can do to help the farming community as it relates to taxation, or just helping them with the cost of production so that the prices of locally produced fruits and vegetables, for example, can go down? These are things that we need to look at. And then having community programs where we can teach people how to start a little garden, right? Community gardens, or how to have a little tire garden, even if you don't have a big, expansive backyard, a little tire garden that you can start to grow little things for yourself to help out with the food bill. So we're not closing our eyes and saying, oh, everybody can afford to eat a certain way, because that's certainly not the cost. We know that corned beef is a little bit cheaper than fresh chicken, but corned beef is a lot higher in salt, for example. So we acknowledge the difficulties and we say that we really need a community approach to assisting persons who have NCDs or persons, in general who are at risk and really, really need the help in making healthier options available.
Okay. Miss Laverne Pinder agrees with you. She said that fast food is more expensive. My daily meals contain some starch, some vegetables cooked with chicken or fish, and I guess she finds that to be a lot cheaper than fast food.
It most certainly is. And you know what's cheaper? Meal planning. If you plan in advance, you don't have to go in the supermarket and pick up random things and then realize, well, these things don't make up a meal. So then that's what a whole lot of people fall into that trap. They go into the supermarket, they pick up random things. They're not the healthiest. They haven't planned in advance what they will cook. They haven't planned for the week. So they wake up in the morning and there's nothing there. So they have to give the children lunch money to buy from the canteens and they have to buy from elsewhere. All of that is wasted money and you're not getting the health benefits that you should get from that food. So again, planning your meals and knowing that you don't need to have a quarter chicken on your food. The portion sizes too are too small. If the portion sizes were what they should be, the food would stretch longer. So you'll be able to cook, and what would normally serve your family in one day could possibly serve for two. Because you don't need a quarter chicken per person. Every person can have the portion of meat that is suitable for them. Usually that's the size of their pound, whatever age they are, and that is enough meat. So I think we need to look at all of those things in terms of planning and affordability.
Terry Jones says that more education is needed overall. Some sauces and dressing also contain lots of sugar. Um, Going back to the front of label point that you were making, is that something similar to what was done with the cigarette industry in terms of having those front of label advisories um, there? Is that something
Yes,
that
I
which
I would say so, and I think that is very, very evidence again, because we always have to look at the evidence. We can't just go on hunches and feelings. That's not the way that we practice in medicine or public health. And the evidence has shown that these things are effective, including the front of package labeling. And that is
okay?
something that I think will significantly help Barbadians to make healthier choices. I'll give you an example. The average Barbadian, or I shouldn't say the average Barbadian, the American Heart Association recommends that a child or an adult should use no more than 24 grams of added sugars in an entire day. 24 grams is the equivalent of about 6 teaspoons or so. For a male, the recommendation is no more than 9 teaspoons of sugar in a day, and that's the about 36 grams of sugar. One of the more popular producers of sweetened of sodas in this country, their sugar content is up to 68 grams of
Wow.
sugar in one 500 ml. That's 17 teaspoons of sugar. Twice that, more than twice that, nearly 3 times that of the recommendation for a child, what a child or woman should use in an entire day in one drink. And persons drink, including children, multiple of these per day. So imagine a child having a box juice that has in 40 grams of sugar, because some of our locally produced box juices having as much as 40 grams of sugar, which again is 10 teaspoons. So a child getting up in the morning and getting that 10 teaspoons of sugar in that one drink, then having a soft drink at break with the 17 teaspoons. That's how much so far? 27. Add
My
another
maths was
10
never good
or
at school.
right, 27. Add another 10 or 17 in the evening. You're close to 40 teaspoons of sugar in one day that child is consuming or that adult is consuming. And that is the problem when we talk about sugar, sweetened beverages. And it's not just the sugar, sweetened beverages that everybody says. It's the cakes, it's the pastries, it's the gummy bears they're going to have, it's the chocolates they're going to have. All of that comes together to create a real nightmare for us. So what front of package labeling does is that it alerts the consumer right away that this product is high in sugar and high in salt, so that they can look at the nutrition facts and understand what they are looking at. And that's really important. If you don't have that alert, you will take up the drink and not even think about it. Because I'm sure that many times you yourself, I myself, have taken up drinks and not thought about what I was putting into my body, or taken a snack and not thought about what I was putting into my body. But if we have front of package labeling, at least it causes people to pause and think before they buy. That's really important.
Okay. No, what I've noticed, perusing the research as well too, is that within the WHO recommendations would be using the monies garnered from like taxes such as sweet drink tax to be applied to the healthcare system, or to be applied to the NCD fight. Um, However, in what I've seen thus far in the legislation as implemented, I haven't seen that specification. I've seen more or less, it may be going back to the consolidated fund. I haven't seen that specification. Is that something that you would like, or the organization you represent would like to see in terms of specifically saying, well, these funds would be identified for the NCD fight, or they will be identified to be going back directly into the healthcare system. So definitely would not be going or being lost within the consolidated fund.
I think that in general, the medical fraternity would like to see that, because there's no doubt that our systems are overrun. Um, we have a lot of persons in the system who need assistance, and finances are low. The resources are low, and we would love to be able to provide optimum health care to persons who are ill throughout the system. So wherever we can inject more funds, yeah, I don't think anybody ever says no to money, right? So wherever we can have more funds flowing into the system to help us to optimize it so that persons remain in good health, that would be optimal, especially like in the polyclinic systems in the hospital. So I will not speak to that at the level of policy, because I do not think that I am positioned to speak to that at the level of policy. What I will say is that as a practitioner on the ground, having interacted with the public system, I do see the need for a much greater injection of funds. We understand, however, that there's a massive financial contribution that is being made towards health. I think the problem is where it's being directed. The vast majority of the monies that are pushed towards our healthcare burden are pushed towards treatment as opposed to prevention. If we pushed a lot more of our money towards preventative medicine, we could prevent a lot of the complications that then become very expensive for us to treat. When you look at the cost of providing care for persons, for example, who are on dialysis, or somebody who has an amputation and can no longer work, or persons who are in and out of the hospital because of other complications if they're hypertension or diabetes. We understand that if those complications did not occur or if we could push them back, that we could save a lot more money yearly. So even as we look at directing that money towards healthcare, what I would like to see is a greater focus on programs that deal with preventative care.
Okay, you alluded to this earlier in terms of COVID and how that has compounded the NCD situation in Barbados, given inactivity among children, especially persons not being able to get the type of care, treatment for their NCDs, diabetes, etc. Um, paint me a picture. Go into a little more detail. Drill down for me a bit on the type of complications that this pandemic has now created for Barbados' NCD situation.
I think that generally, if you talk to general practitioners, I don't like to say things without statistics to back it, but what I can say is that if you talk to general practitioners and nurses and just persons in healthcare on the ground, we are finding that a lot more people are poorly controlled. So the blood pressures are up in the air, the blood sugars are up in the air, the blood tests, the renal indices, for example, the kidney function is poor. So we are finding a lot of complications because persons were not able to access their doctors to be seen so that their medications could be properly changed. And persons in some cases were not able to access medication or they were reluctant to go into a healthcare setting because they were afraid of COVID to access their prescriptions and get their medication. So I suspect that in the coming year or two, I believe that we're already seeing it, that we're going to see a massive fallout as it relates to NCDs and their complications because of the situation with COVID. And that is something that I think that government needs to be prepared for and aware of so that I don't think it's going to catch us by surprise. I'm sure that they've already taken that into account because, like I said, the patterns are there on the ground. And it just shows you how fragile our healthcare system is. And when you have a country where there's a large burden of NCDs, because 1 in 3 people, the last set of research showed that 1 in 3 people in Barbados has high blood pressure, and 1 in 5 people has diabetes, and the rate goes up in persons over the age of 65. It's much higher. We have almost half the population having diabetes. That's a huge and a massive burden on the healthcare system. And what that means is that the healthcare system is easily overwhelmed if there's another insult. And COVID was the other insult. It was the thing that came along and took up all of our resources, took up our doctors, took up our nurses, took up our finances. And it shows that our healthcare system needs to be more robust. And what this means is that we need to lower the burden on it. We really, really need to look at that. And that's why I'm pushing for a lot more preventative care.
Okay. I see Miss Fidelis St. Hill agrees with either, I don't know if it's my point or your point, need to direct the proceeds of the taxes towards policies that encourage testing pre-NCD conditions such as insulin resistance, calcification tests, and vitamin deficiencies. Those some terms I guess you might understand. So she seems to be agreeing with you in terms of the preventative aspect of
I
things.
agree with having people tested. I want to say to workplaces, invest in your people. When your people are not at work, you lose significant productivity. If you can have a doctor or a nurse come in every year and test your people for NCDs, check simple things like their blood pressure and their blood sugars, persons that would not normally go out to the doctor, they would be happy to have it done at work, and we can flag people early. The thing is that you have people who will go 10, 15 years who are diabetic or hypertensive and not know it. By the time the healthcare system captures them, they are so ill that they are now dependent on a number of medications and heading towards complications. So we do want to redirect those funds towards screening persons early so that if you, for example, have a blood sugar that shows that you are pre-diabetic, you are in a key position to make some lifestyle changes so that you do not go on to develop full-blown diabetes. If you realize that your blood pressures are getting higher, you might not be in the hypertensive range, but now you are in a key position to say, okay, let's make some changes so that I do not become hypertensive. So it's really important that we redirect the funds into preventative care, not only in stopping people from developing NCDs, but also in helping those who do have the NCDs to manage them well so we can avoid the complications.
Okay. Ms. Dawn Grace Fenty concurs in just one word, true. So you're having some support here. We are coming down to the winding down stage of our program. So I'm gonna give you the last word to touch on any other issues that you see needs to be highlighted on World Health Day.
What I want to say to Barbados is that we've talked a lot about your dietary intake, but being physically active, health is holistic, right? So being physically active is very, very important. We want to encourage Barbadians to get up and move as much as possible. We know that it is difficult at times. Sometimes people are working numerous jobs and they're having difficulty finding the time to do it. But it might be just walking, getting up from your desk and stretching during the day, choosing to take the stairs, parking further away so that you have a good walk, whether it's downtown or a good walk to your building. Things like that can make a big difference in terms of your health. We want people to make their health a priority because are you are irreplaceable to the people that love you the most. So if you run down yourself and you don't take care of yourself, your job might be able to replace you, but to the people that you matter the most to, you are irreplaceable. And so you want people to really invest in their health. On a World Health Day, I also want to remind persons that mental health, I always have to say this, I always have to put in a plug, is so important. You are better able to take care of your physical health if you are in a good mental state. So find things that help with stress relief. Stress is a big factor in raising blood pressure and blood sugar. Find things that are healthy that you enjoy, whether it's a walk on the beach, whether it's talking to relatives, whether it's a hobby, and better yet, things like exercise that help to take down the stress levels and also address, your cardiovascular risk factors. Find things to do with your mental health. Don't ignore it. And if you find that you are struggling, whether it be with depression or anxiety, with low moods, get the necessary help. Don't be ashamed to reach out to your healthcare practitioners so that you have a holistic picture of health. You're able to take good care of your mind, able to take good care of your body, and you are the most productive version of yourself. The last thing I would say is that I urge Barbadians to support the things that we are implementing, the measures that we are putting in place. It is not to lord over you, but it is for the good of the country. It is for the good of our future generations. We need to do something. We have a corporate responsibility to ourselves. We have a corporate responsibility to each other, to provide a protective environment where we can thrive and be healthy. So I want to urge you to support the measures as they come out. They are not to, take away your freedoms. You will always have the right to choose, but we want to encourage you to choose a lifestyle that is healthy and is supportive and allows you to be productive and to live long, happy lives. That's all we want as professionals and in the medical field and as health advocates. That's all we want. We want healthy, productive citizens.
Okay. Dr. Lewis, a mouthful from you there as it relates to what your wishes are for Barbadians to embark upon from today. Now, again, I want to thank you. This was again short notice, Dr. Lewis, for taking the time and imparting your wisdom within your profession to us. And I am sure that all viewers appreciated everything as well. So, again, thank you again, and do have a lovely day, everyone. And thank you for joining us on State of Our Nation.
Thank you so much.